I'm just going to go ahead and check my patient's vital signs. By checking her vital signs, I'll be able to establish any trends in her condition. I'll also be able to understand any other underlying health issues that may be contributing to her current injury. First thing I'll do is get my patient's consent and also make sure she knows what's happening as I'm checking her vitals, so she is not confused and she's able to follow. Ma'am, I'm just going to double check your blood pressure. I'm just going to pop this cuff around your arm. It won't be sore, you may feel a bit discomfort, but nothing to be a concern. Is that alright with you?
Yeah, that's okay.
Awesome. So I'm just going to pop the cuff around her arm, making sure that the artery line is aligned with her artery. And then just securing the cuff around the arm. Sweet, just using the stethoscope. Just going to pop that under the cuff. I'll be able to listen to the systolic and the diastolic rate from there. Cool. First listening for the systolic. Cool. And then listening for the second knock. Awesome. So I can see that her blood pressure is 120/80. That's pretty normal, nothing to be concerned of. Cool, I'll now check her heart rate. So to check her heart rate, I will palpate her radial artery and listen to beats per minute. I will do it in sections, so listening out for 6 seconds and then multiplying it by 10. I'll do that now. Awesome. So that is about 60. That's pretty normal. Again, nothing to be concerned of. I'm just going to check her capillary refill time. That's about 3 seconds. So again, pretty normal, nothing to be worried about. Now I'm going to check her temperature. Ma'am, is it okay if I pop this device in your ear just to check your temperature?
Yeah, that's okay.
Awesome. Sweet, so it's about 36.5 degrees, pretty normal. I'll now check her blood glucose. So to check her blood glucose, I'll explain to the patient that a small prick will be felt on one of her fingers. Won't be sore or anything, just a small prick just to get some blood out. I will then put the strip into this machine just to measure her blood glucose. Is that alright, ma'am?
Yeah, that's
You'll
okay.
just feel a small prick, but nothing to be concerned of. Anything between 3 to 8 is pretty normal. I will now check her respiratory rate. I won't tell the patient that I'm checking her respiratory rate because I don't want her to alter her breathing. I do want an accurate reading. I may also check words per breath. I may also check for chest rise and fall. When auscultating, I'm listening out for any abnormal sounds. I'm listening out for her breathing. Big breath in for me. And big breath out. Cool. Breathe in and out. One more time. Awesome. Her lungs sound clear. Due to her fall, she may have suffered some trauma with her lungs, but everything seems to sound okay. I'm just going to check her pupils just to make sure that there's no damage there. Ma'am, I'm just going to shine a torch over your eyes. Nothing to be worried about. Just follow the light as you see it. All good?
All good.
Cool. Awesome. Her eyes seem pearl. Nothing to be worried there. And also when checking her heart rate, just taking note of her pulse strength. Seems pretty regular and her skin is cool to touch. I may think of putting a blanket over her to keep her warm. So we have a C collar here. So I'm going to place it around my patient's neck. She may have a potential spinal injury or neck injury. Before I start, I'm just going to measure it from her jawline to her shoulder just to make sure that it fits properly. So I'm just going to use my fingers and I can use 3 here and measure against the C collar. I can see that's short, so I'm just going to adjust that to short. While I'm doing this, I'm just going to get Andrew to secure her head by placing his hands around her head. Taha, is it okay if I place the seat collar just around your neck, just to help support and immobilize your neck? Okay. Sweet as. Just on my count, I'm just going to slide the seat collar under your neck and then we'll secure it from there. Sweet as. 3, 2, 1. Just going under. Cool. I'm just going to put this around and then secure it from there. Sweet as. That looks secure to me. Taha, do you feel good? Is that all good? Mm-hmm. Cool. Contradictions to using this is that we may need to manage her airway, but she seems to be breathing normally and there is no obstruction to her airway. We're responding to a female who has fallen from a tree. Hello, my name is Jasmine and this is Taha. How are you?
Okay.
You're alright? Can you tell us your name?
Mina.
Mina, awesome. Mina, do you know what's happened today?
I fell on the tree.
You fell on the tree? Awesome. So she's able to respond to my commands. She seems to be mentally responsive. I can see that her airway is clear as she's able to respond, and upon observation I can see that her skin colour is not pale, it seems to be nice and pink. I can also see a laceration on her left arm. I can see blood pouring out profusely, and I can also see that maybe a potential injury on her right leg. I can see that her ankle is angulated. Mina, I'm just going to sort out your arm. I'm going to try and stop that bleeding. I'm just going to get you to hold the bandage, thank you. First thing I'm going to do is expose that wound and then clean it with some saline solution to try and stop that bleeding. Awesome, so just going to clean it, wipe out any debris, and then apply direct pressure. So I'm going to get Tara to do that, to apply some direct pressure on that wound. And while she's doing that, I'm going to start bandaging up her arm. Sweet, so Mina, we're just bandaging up your arm just to try and stop this bleeding. Cool, I'm also going to start twisting it as well, just to apply more pressure on that wound. Just pop that there. I'm also going to feel for a pulse. Cool, I can still feel that pulse. I know this isn't too tight. And we're just going to elevate it. We'll keep an eye on her wound, and if it continues to bleed, we'll pop another bandage on, and if that doesn't seem to be working, we'll resort to a tourniquet. So I'm just going to get Taha to get me a tourniquet, please. Mina, we're just going to pop on this tourniquet. It's just going to stop your circulation and hopefully stop the bleeding as well. Once we put it on, we can't take it off till you get to hospital. It's going to be quite tight, but it will stop your bleeding. Is that alright? Awesome. Cool, so we're going to apply it just 10 centimeters above the wound. Just going to fasten it. That's so good. Just twisting it. And we're also going to record the time. Do you have the time with you?
Yeah, it's 6 o'clock.
6 o'clock, cool. And just put the time there. And I'm also going to feel for the pulse again. I shouldn't be able to feel it. To check her pulse, I'm just going to palpate her radial artery. And I can't feel a pulse there, so I know that the bleeding has stopped. Awesome, so I'm about to perform a rapid trauma sweep on my patient just to see if she has any other injuries. Mina, I'm just going to place my hands along your body and feel for any other injuries. You just let me know if it's sore anywhere, alright?
Okay.
Cool. Your neck is sore? Cool. Can I just get the seat collar out? Cool. Any pain there?
No.
Any pain here?
No.
Pain there?
No.
No. Any pain down your leg?
No.
Nothing here? How about this leg?
Yeah.
Sore here on this leg?
Yeah, my ankle.
No, that's alright. because she's complaining of neck pain, she may have a potential spinal injury or a neck injury. Ma'am, so because of the pain you're experiencing, I'm thinking of giving you some methoxyfluorine. So this is a pain relief. It should subside any pain that you're feeling around your leg or your neck. Just some questions to ask you. Are you allergic to anything?
No.
No. Do you know if your family has a history of malignant hypothermia?
No.
No. Do you experience any renal impairments?
No.
And have you taken this in the past week?
No.
No. Because you're able to respond to my commands, you're able to talk, I'm happy to give this to you. It's self-administered, so I'm going to wrap this around your wrist. And you just inhale into the whistle, and you can just take as much as you want. Before I give this to you though, I'm just going to check the expiry date. I can see that says 12/2020. I'm just going to get my authorized check as well.
Yeah.
Sweet, we know that it's not expired. I'm just checking the seals as well, making sure it's all intact, making sure that it's actually methoxyfluorine. And you inhale it into the whistle whenever you need to take some methoxyfluorine. Awesome, so I have a splint here that's been pre-made, we've taped it up. We're going to pop this around her right leg just to support the fracture. Before we go and put the splint in, I'm just going to expose both her legs so I can compare. Because she has jeans on, I'll use some clothing shears just to cut it up, just so I'm able to have easy access. So just lifting both up or cutting both of her jeans up. I'm comparing, and I can see that her left leg appears to be fine and her right leg is severely fractured. It's very discoloured, and her ankle is also angulated. Also, Mina, we're about to pop a splint just under your right leg. If you want to inhale some of that methoxyfluorine right now. Awesome. I'm just checking for pedal pulse. Awesome, I can feel pedal pulse in both. I'm checking for capillary refill time. Sweet, so her left leg was 2 seconds. Her right foot was quite delayed at 4 seconds with the capillary refill time. Mina, can I just get you to wiggle both your toes if you can? Can you wiggle your toes on this foot as well? Cool, can you feel the touch on your toes?
Yeah.
Cool, which toe am I touching?
Both.
Both? The big toe?
Big toe.
Awesome, so she still has good sensation there. Sweet, so we're going to pop the splint just under her leg. I'm just going to get you to support near her knee and just around her ankle, and on my count just lift and we'll pop the splint just under her foot. The towel's been popped around the splint as well, just for extra support. Cool, so on my count, 1, 2, 3. Awesome, you keep inhaling there, Mina, doing a good job. Awesome, just let that down. Cool, we're about to secure the splint now just so that the fracture remains stabilized. So we're going to pop one bandage just around her knee and the other one around her ankle. How's your pain, Mina?
Okay.
Okay, out of 10?
About a 6 now.
A 6, cool, you just keep inhaling into that methoxyfluorine. Cool, just tightening the bandages around her leg. She may need extra pain relief, something stronger, and if that were the case, I would have to cork her back up as we can't administer it ourselves. I would then go ahead and check again her vitals, her baseline, checking the capillary refill time. I can see that her left foot is still 2 seconds and her right foot is still 4. Has your pain subsided? How's your pain now out of 10?
It's a lot less than it was before.
A lot less, maybe a 5?
Yeah.
Awesome, just checking your arm again. I can still see that the bleeding has not begun, it's still stopped.